Welcome to episode 72 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're ending our discussion on acid-base balance by talking about acid-base balance disorders. And we'll explore how disruptions in pH homeostasis lead to metabolic and respiratory acidosis or alkalosis. By the end of this episode, you'll understand how to interpret blood gas values, identify different acid-base imbalances, and determine whether or not compensation is occurring. So let's get started. As we discussed previously, acid-base imbalances occur when blood pH falls outside the normal range of 7.35 to 7.45. These imbalances are classified into four primary disorders: respiratory acidosis, when you have high carbon dioxide and low pH; respiratory alkalosis, when you have low carbon dioxide and high pH; metabolic acidosis, when you have low bicarbonate and pH; and then metabolic alkalosis, where you have high bicarbonate and pH. To diagnose an acid-base disorder, we analyze arterial blood gas values, which include pH to determine if the blood is acidic or alkaline, the partial pressure of carbon dioxide. Normal values are 35 to 45 millimeters of mercury, and this will give us an idea of what's going on with respiratory function. Remember, carbon dioxide is an acid, so high values indicate an acidosis, and low values will indicate or suggest alkalosis. And then bicarbonate. And bicarbonate values are normally between 22 and 26 milliequivalents per liter. Bicarbonate is a base, and so that means that low values will indicate acidosis and high values will indicate alkalosis. Bicarbonate reflects metabolic function. So we've got two types of respiratory acid disorders. So respiratory acidosis occurs when someone is hypoventilating. So this is caused by inadequate carbon dioxide elimination, such as what happens with someone who has COPD, respiratory depression, or some sort of airway obstruction. A person with respiratory acidosis will have an acidic pH, which is less than 7.35, while also having a CO2 that is greater than 45 millimeters of mercury. The bicarbonate will be normal if it's uncompensated or increased if it's compensated. The kidneys will increase bicarbonate reabsorption to buffer excess hydrogen ion during compensation. Next, we have respiratory alkalosis, which occurs during hyperventilation. So this is caused by excessive carbon dioxide elimination, such as that happens during anxiety, fever, high altitude, or pain. So in this case, blood gases will have an alkaline pH greater than 7.45. As well as an alkaline carbon dioxide, where that will be less than 35 millimeters of mercury. Bicarbonate will be normal if it's uncompensated or decreased if it's compensated. In this case, during compensation, the kidneys will excrete more bicarbonate, which will reduce pH back to normal. Then we have our two metabolic acid-base disorders. So you've got metabolic acidosis, which is caused by excess acid production or bicarbonate loss, such as what happens with diabetic ketoacidosis, diarrhea, or renal failure. In this case, you'll have an acidic pH less than 7.35, as well as an acidic bicarbonate, which is less than 22 milliequivalents per liter. Carbon dioxide will be normal if it's uncompensated or decreased if it's compensated. If compensation occurs, the lungs will increase ventilation to eliminate carbon dioxide. Finally, we have metabolic alkalosis. This is caused by excessive bicarbonate retention or acid loss. This occurs with vomiting, excessive antacid use, or excessive aldosterone release. In this case, pH would be greater than 7.45, indicating that alkalosis condition. Bicarbonate will also be alkaline, greater than 26 milliequivalents per liter, and carbon dioxide will be normal if it's uncompensated or increased if it's compensated. So to summarize, acid-base disorders are classified as respiratory or metabolic based on carbon dioxide and bicarbonate levels. Respiratory imbalances result from carbon dioxide changes, while metabolic imbalances result from bicarbonate changes. The body will compensate through the respiratory or renal systems to restore pH balance. Interpreting blood gas values helps identify the type of disorder and whether or not compensation has occurred. And so that's it for episode 72. I hope this episode has helped clarify how acid-base disorders are diagnosed and compensation occurs. Come back next time for episode 73, where we'll start our journey into the digestive system, where we talk about digestive structures and functions. Till then, keep questioning, keep exploring, and stay curious.